presents disorder. So what we notice is that due to training adaptation, healthy athletes may have a distinctive movement pattern that differs from that of healthy untrained subjects. And what I really want to do now is just to leave you with a question for consideration. Really, what are the potential implications of these findings for the rehabilitation of the athlete, and particularly for the elite athlete whose style of movement may be that factor which gives them the cutting edge in a particular group? That means that when we rehabilitate, and we rehabilitate to the standard for a normal, untrained collective, we may actually be pushing that athlete back, removing that advantage that they have, getting them back into training, but they may then fall lower in the standings. Okay? So I just want to leave you with that. For any more information on the Bandcamp one, you can check the reference at the bottom. And I'd just like to say thank you for your attention.
Thank you again, Dr. Williams. Having used the Vicon system myself, I know it's quite tedious to set up. The calibration makes you look a bit like a crazy man or woman. You're waving around in an airport, not sure how you're going to direct the planes. But however, the feedback that we get, I think, is worth the setup time. This is a very good example of how we could use technology and data and possibly a different perspective to assist the development of sport across the board. So here we have people from a engineering, physics sort of background coming and applying themselves. I see Dwayne smiling because he's been doing a bit of that himself in terms of the technology that he provides for sport analysis. So we go on to our last panelist for this segment, Dr. Jagasa. Right, we're looking at the bench press and body position.
Let me see if I can get this. See, everyone got difficulties with it. You're not seeing the answer. Figure a second page. I'm not seeing you. You have to bring it. This one. You don't see it here? No. Okay, good afternoon, everyone. Good morning. All right, good morning. First of all, I would like to thank God for giving me the strength and knowledge to conduct this research. I must give special thanks to Professor Paul Blair and Dr. Tony Grice from the University of Trinidad and Tobago, as well as Professor David Sanderson from the University of British Columbia, for providing tremendous support and supervision throughout the length of this research. Now, how many of you are familiar with the horizontal bench press? Good. So basically, for the horizontal bench press, you would lie supine on a flat bench and press a weight through the concentric and eccentric phases of the lift. Now, powerlifters and bodybuilders, they perform the bench press, but for two different purposes. Powerlifters look to maximize weight lifted, whereas bodybuilders look to maximize muscle fiber recruitment. In other words, when they do that, they would maximize muscle hypertrophy. So, how many of you, when you perform the horizontal bench press, experience discomfort in the shoulder? Show of hand? Right. You will see why in a little while, why this happens. So there are many views on which bench press position would maximize recruitment of the pectoralis major. So there are some of these positions may contribute to shoulder injuries as well as lower back injuries. A very pertinent question: do horizontal bench press positions that have potential to cause injury maximize recruitment? So the purpose of this study, we wanted to determine if there's a specific body position that would maximize muscle fiber recruitment of the anterior deltoid, the upper clavicular head of the pectoralis major, and the lower sternocostal head of the pectoralis major. So we formulated the null hypothesis. Varying scapular and lower back orientations will not result in significant EMG differences in the upper chest, lower chest, and anterior deltoid during the concentric phase of the horizontal bench press. So we just looked at the upward phase of the lift. So we utilize something called electromyography, and basically it measures change in electrical potential of a contracted muscle. Clinical EMG is used as a diagnostic tool to assess nerve and muscle function, whereas kinesiological EMG is used to study function and coordination. We could go on a lengthy discussion on this, but we don't have time for that right now. So there are many variations of the bench press. You can use varying widths of grip, different trunk inclinations, such as decline, flat, incline. We can use dumbbells versus barbells. In the research, many of these variations have previously been examined. So there are several variables that can affect the EMG data. Time taken for lift. So if you take a longer time to lift that weight, the EMG activity that you're going to get is going to be greater over a longer period of time. Fatigue effects. As a muscle becomes fatigued, what happens? The amplitude of the signal will increase, and the median frequency of the signal decreases. So you must try at all times to not have the muscles fatigued when you're doing this kind of analysis. As well as skin preparation. If the skin is not properly cleansed, then you will have attenuation of the signal. That means you won't get a clear signal. Okay? And the electrodes will not adhere properly to the skin. Then we have electrode type, size, and placement. You must be consistent with the type of electrode and size of electrode that you use. So test subjects in previous research, we had subjects had 6 months to 2 years retraining experience. Number of participants range from 6 to 15, and only one study examined both genders. So on width of grip, we had Clemens and Aaron in 1997 looking at width of grip for the collective set of prime movers. The collective set of prime movers were the pectoralis major, the anterior deltoid, the triceps brachii, and they included the biceps brachii as well. So they defined their width of grips in terms of bioacromial widths. And we know what is our bioacromial width, or acromion processes, just the bony process at the top of our shoulders. So they found it as a percentage of that distance. So you see there were 4 widths of grip from 100% going all the way up to 190%. We see here that as width of grip increases, the EMG activity, which was normalized to the percentage of maximum voluntary isometric contractions, increased. Again, here we see Barnett et al. In 1995 looking at a wide 200% bioacromial width versus a narrow width of grip 100% bioacromial width. If you look closely at the chart, you will see for the wide grip, the horizontal and the inclined bench press produce greater activity than the narrow grip. Versus the declined bench press, we saw that the narrow grip produced greater activity than the wide grip. The vertical that you're seeing here is simply a shoulder press. All right? Lemon in 2005 showed that a more narrow grip increased activity of the triceps brachii, whilst decreasing activity in the sternocostal head of the pectoralis major. On trunk inclination, we had Barnett again in et al. 1995, looking at the clavicular head, and we see here that the inclined bench press produced just a little more activity than the horizontal, followed by the decline and then the shoulder press or the vertical position here. Glass and Armstrong in 1997, their results contradict that found by Barnett et al. And others. You see here for the incline and the decline, they produce almost the same activity. Welch et al. In 2005 looked at times of activation for the pectoralis major and the anterior deltoid for the barbell bench press, dumbbell bench press, and the dumbbell fly. What they found was that the time of activation during the concentric phase of the lift, the dumbbell fly produced the least time of activation. So they therefore suggested that the dumbbell fly should be used as an auxiliary lift. And dumbbell and barbell bench presses can be used interchangeably in training programs. Practical implications coming out of the literature review. The best width of grip is between 165 to 190% of the biacromial width. The horizontal bench press can be used for recruiting both heads of the pectoralis major, that is the upper and the lower. And the closed grip inclined barbell bench press can be used for recruitment of the upper clavicular head, because we saw it produced just a slight greater activity than the horizontal. So if you want that edge, you can utilize the inclined barbell bench press. And dumbbells and barbells can be used interchangeably to overcome training plateaus. Now we had Larson in 2008 looking at conjugal effects. Now some of you all mentioned that you got shoulder pain, right? A flat bench surface, what it does, what they explain here, is that it restricts movement or natural movement of the scapula. In other words, when your arms are coming down in the eccentric phase, the scapula cannot retract naturally. As well as when you're moving up in the concentric phase, it cannot protract. All right? So you see here that the humerus is horizontally extended to complete that downward phase. The humerus separates. And what is going to happen? In the glenoid cavity, you're going to get articulating surfaces rubbing against each other, and that will cause conjugal effects. It's a possible cause for it. So he suggested to fix the problem by using something that we find around swimming pools, a pool noodle, placing that along the length of the spine, and you lie on top of that. What it does, it elevates the spine, and it creates space for the scapula to move. All right? So gaps in the literature. Body position was neither examined nor studied during the horizontal bench press with respect to scapular mobility and lower back orientation. So these are the two variables that we looked at. Methods. So I attained approvals from the Research Ethics Board at the University of British Columbia and at the University of Trinidad and Tobago. I did the online tri-council policy statement before any research was undertaken. 40 males were selected. They signed consent forms. 9 were Canadians, 5 were Trinidadians. All had at least 2 years consistent weight training experience. 2 were powerlifters, 2 bodybuilders, and 10 fitness enthusiasts. So we have 5 predetermined bench press positions here. So we want to look at scapular mobility and lower back orientation. So what we did, to look at the effect of scapular mobility on EMG activity, we looked at positions 2 and position 3. We fixed glenohumeral joint angle at 70 degrees. This SR that you see here, whenever you see this acronym, it's when we use the pool noodle on the surface. SN would be a flat surface. And then we had lower back orientations fixed at naturally arched for positions 2 and 3. To investigate lower back orientation, we looked at positions 1, 4, and 5. We fixed glenohumeral joint angles at 50 degrees. We fixed scapular mobility using the pool noodle SR, 1, 4, and 5. And we looked at 3 lower back orientations, naturally arched, and flat. We maintained glenohumeral joint angles at 50 and 70 degrees by using vertical PVC poles. So when the medial part of the upper arm is slightly brushing against those PVC poles, the angles will be maintained and controlled. Over here, we see the